So welcome back, everyone. I hope you had a good lunch. We will now resume with our third session, which I'm sure is of much concern to most of us, given the skyrocketing cost of insurance and medication, namely the health sector. The session is entitled, as you all know, Lebanon Economic Crisis by Sector, Reforming the Healthcare System, which will be moderated by Mr. Hadi Psat. Please allow me to introduce him before I turn the floor to him. But before I do that, I just want to remind everyone that there is simultaneous interpretation في ترجمة فورية إن كان بالقاعة وإن كان افتراضيا. Mr. Hadi Psat, founder and CEO of DRAP, a rising cross-borders telehealth startup giving access to quality healthcare for patients in more than 100 countries. Founder and chairman of ProMeds, a leading regional medical supplies group focusing on the Levant region and representing world-renowned medical equipment and devices manufacturers. Founding and board member of the Lebanese Private Sector Network, previous vice president of the Syndicate of Medical Equipment and Devices Importers in Lebanon. Mr. Psat holds a master's in biomedical engineering from Wright State University in Ohio, and a Bachelor's of Sciences from the American University of Beirut. He lives between Cairo and Beirut, and we're very lucky to have him here with us today. And I want to say thank you again, Hadi, and to all our panelists, and the floor is yours. Thank you.
Okay. Thank you so much for the introduction, and thank you for the panelists that I will introduce in a minute. Our topic is the reforms in healthcare and that are needed for our country. And as you know, the healthcare used to constitute 8% of almost 9% of the GDP. And 50% of that was coming from the private sector. Unfortunately, today, you can see that more than 80% of the Lebanese population is suffering without proper healthcare coverage, which is added by severe strain coming also from lots of refugees that also benefited from the subsidization of healthcare in Lebanon. So with all of these strains that we will hear more about from our panelists, I would like to highlight as well opportunities. And we at the Lebanese Private Sector Network, we were able to highlight 3 opportunities. And when I say opportunities, I mean investments, I mean job creations, I mean dollar inflow into the country. And these were, number one was the pharmaceutical production, which currently constitutes 8% of the local market size. And imagine if we can double or triple that size. Number 2 is the home care services. This is a great area for investment because it reduces significantly the cost of hospitalization. And number 3 is health tech. We believe with health tech, we have a lot of local Lebanese expertise that we can export their knowledge without letting them go from the country, and accordingly, we can bring in dollar into the country with that. Definitely, these opportunities cannot work alone. We need a lot of reforms and a lot of restructuring. And with restructuring, to give an example, in Lebanon, probably the Ministry of Health has done a great job with the primary care service. They have started interesting part. I think you will talk more about that. But on the other hand, we are still far behind the universal health coverage. So a lot of that will be needed. And this is where, allow me to introduce our speakers, Dr. Fadi Al-Jaldali and Mrs. Clara Abu Samra. And Dr. Fadi Al-Jaldali, he's the founder and director of the Knowledge to Policy K2P Center, director of the World Health Organization, Collaborating Center for Evidence-Informed Policy and Practice, co-director of the Center of Systematic Reviews in Health Policy and Systems Research, SPARC, and an adjunct professor at McMaster University in Canada. Dr. Jardali unfortunately couldn't make it in person with us, so he will be with us now on a video conference to present, and he will be supported by Mrs. Clara Abu Samra, who is a senior lead at the K2P Center and renowned public health expert with more than 10 years of prominent expertise in health and social system strengthening, performance optimization, strategic intelligence, political economy analysis, and evidence-informed policy and practice. Clara has supported several ministries, UN agencies, and NGOs locally and internationally in developing and advancing evidence-informed health and social policies into impact. This includes the development of standards for daycare centers, hospitals, primary healthcare centers, and health and social strategies and policies. As an instructor of public health at the American University of Beirut, she plays a pivotal role in shaping the future of health and social systems across the globe. So we'll give the floor now.
Good afternoon. Thank you so much for the invitation from LCPS, and apologies again for not being able to be with you in this interesting meeting and roundtable, particularly that's a discussion about reviving Lebanon economy, particularly in the four sectors where LCPS has done significant work on that. My apologies again for not being with you in person due to travel, but certainly my colleague from the Knowledge and Policy Center, K2P, will be with you. But I thought to actually share some of the insight and finding we got for the policy brief that we have done together, particularly with the focus on the way forward for the health sector in Lebanon. Let me tell you that, as you know, that in the case of Lebanon, there has been a lot of systemic deficiencies in the system for many years, and there has been really a chronic, a process of over-promising and under-delivering when it comes to health system in general. If you look at the ministerial statement, البيانات الوزارية, since year 2000 up till 2022, there has been really recurrent promises and statement in the ministerial statement when it comes to health and medicine card, to the issues about the universal healthcare coverage, prevention, curative, primary care, law, when it comes to universal healthcare coverage, among others. But there's a lot of overlapping promises, but not necessarily really delivering on much of those promises that came from the ministerial statement. Same thing if you look at the latest election, May 2022, you will see that most of the political parties and candidates, in their political platform, they promised, most of them, they actually promise on delivering universal health coverage, improving access to medicine, health card, strengthening public hospitals, reforming National Social Security Fund, elderly coverage, primary care, unifying insurance funds, human resources, central lab, and mental health. You'll see most of those recurring, but you'll see the first two, most universal coverage and access to medicine came very strongly on most of the political platform. But at the same time, you'll see now we'll talk a little bit about the reality when it comes to this. So these are all promises. If you look at, again, the specifically when it comes to universal healthcare coverage law, if you look, and we have really done mapping since 1971, since the Minister of Health, Dr. Emil Bitar, he issued at that time a decision to launch the health card. And then we moved really since 1971 up to 2023. But you will see there has been really several promises when it comes to universal coverage, some at the level of health cards, some at the level of, a draft compulsory and universal health coverage law. There was a different draft bills that already been prepared even at the time of Atif Majalani at the chair parliamentary committee, and then the other minister that have been involved in it. So you can see there's a lot of draft bills and laws under different naming, some under the الرعاية الصحية الشاملة الإلزامية, some under the البطاقة الصحية, some about التغطية الصحية الشاملة, مشروع البطاقة الصحية. Again, a lot of we don't have, unfortunately, a law when it comes to universal health coverage. Now, again, we've also done matching and mapping. You'll see many of the elements that are really recurring, just more pushing, and kicking most of the problem over time and over the years, but still no significant breakthrough, to be honest with you. So this is really more of that. Even a lot of about the mental, referring to primary care, public hospital, and other. So reality is that when we say, I think we all know that after the economic crisis, and the devaluation of the Lebanese lira, there has been a significant challenge of people accessing healthcare, particularly people that are coming from the 6 public funds. We have the distribution about the insurance coverage, in the case of Lebanon, that we all know that, according to the estimates, we have more than 85% out-of-pocket expenditure. So basically, people that were insured by public funds, whether Daman or Widara or other public funds, they are not in reality. They are, so either they have to pay for private insurance or to have to pay cash when they seek services. You will see the distribution of population without coverage in Lebanon, without any type of formal coverage. And this means that they requires really more of having enough cash to seek healthcare, particularly if they go to curative centers and hospitals. Reality also that more than 70% of the Lebanese lack access to essential medication. We've all seen in the last 2 years the issues about the shortages of essential medication and drugs. Stock of medication had dropped in Lebanon. Of course, some of those percentages vary depending on the situation and the medication المدعوم والمش مدعوم. 25 to 30% of available medication is smuggled into Lebanon or counterfeit. 55% Lebanese do not have benefit from any form of healthcare coverage, and 33% of people above 65 do not have any form of health insurance. So that's the reality, despite, again, decades of promises, decades of speaking about we have the best healthcare system, decades of talking about universal coverage, among others, but still we have a major deficiencies in the system, and there hasn't been really any breakthrough. If you look at the 25 of the health expenditure spent on pharmaceuticals, is a bit high. More than 70% of drugs are brand name, despite all the effort to promote more generics. 12 local manufacturing in Lebanon, which is great, but still they need more incentive. No central lab, although the Lebanese LDA, hopefully that law will become into مراسيم تطبيقية يتطبق, which is really, I think, is a very important law if implemented in the right way, and out-of-pocket expenditure increased to more than 85%. So what are the bottlenecks and what are the challenges and opportunities? Bottleneck, we have 3 major bottlenecks. We have the inefficient governance of the health system, insufficient public oversight, absence of efficient accountability mechanism, lack of unified tariff across hospitals and facilities. Every fund has its own contractual arrangement, inadequate coordination among financing agents and providers, and difficulty in extending social health protection. Now, when it comes to unequitable and unsustainable financing system, we have fragmentation of the health financing schemes and systems, absence of incentive structure for efficient resource allocation. I have to say there is a lot of waste and corruption in the existing status quo, and accumulation of debts from Ministry of Health and National Social Security Fund. Certainly, when it comes to economic crisis, we all know with the devaluation, the cost of medication, cost of supplies, inflation in medical claims, inability of public funds to cover the cost of hospitalization according to the fresh dollar rate, and change in the portfolio and loss of ratio in the beneficiary pools of private health insurance due to, again, many reasons related to that. So again, this is till now, unfortunately, we don't have a unified and shared vision for health across all different stakeholder groups, public and private funders, syndicate, and insurance, absence of efficient accountability mechanism that led to decades of corruption, and lack of a comprehensive, well-defined national strategy for human resources for health, which is really also important. Also, when it comes to we don't have sufficient public oversight. That's why we have inefficiencies, and we don't have optimization of the existing resources and how we are allocating it. And the budgeting structure of successive government is not result-driven. So in Lebanon, unfortunately, we don't budget according to result and performance. It's mostly, and this is really, and it's not even linked to performance indicators. So that was challenging, of course, when it comes to controlling costs. At the delivery level, health system, we don't have a real public health system in Lebanon. We have a sick care system. So basically, it operates in silo, discontinued from the broader upstream forces, dominance of the private sector in the provision of care, which is fine as long as actually their role is clear, regulated well, and they are also part and parcel of contributing to public good. Healthcare provision is highly concentrated in hospital and curative care, despite we still, unfortunately, we spend less than 10% of public expenditure on health to primary preventive care. If you look at OECD countries and others, more than 30-40% goes to primary health care. Limited investment in public sector infrastructure. Of course, the limited number of healthcare professionals also to meet the population need, and the local medication manufacturing also are not incentivized in the country as well to actually more promote and local production. So again, despite all the previous governments their promises to strengthen preventive care, still the number and expenditure allocated to preventive represented only 1.1% of the total MOPH budget in 2022, which is really not sufficient. A lot of dependency in donor fund, which is not sustainable. And the expenditure on curative care, meaning hospital, has increased from 66% to around 74% 2022, which was also really quite significant. Even at the level of the major public fund, Ministry of Health vision versus NSSF vision. I'm not gonna, for the sake of time, I'm gonna read it, but you can see there's also divergence of, there is no unified vision yet. So there's no common vision. That's why certainly there is a need to leverage and engage with the private sector, but it's a very constructed and structured way that does not really, or others. So again, when it comes to budgeting, as I told you, it's not result driven. It's not linked to so there's no value-based healthcare. If you look at many countries in the region now, mostly they are going into value-based healthcare. You don't only reimburse on volume of services, but also on the quality and the outcome. The issue about incentive, disincentive, accountability, transparency, all these are issues when it comes to even in the latest ILO report, when it comes to reforming National Social Security Fund, there was a clear call for urgent reform to prevent collapse from shifting from fee-for-service to capitation-based payment, when it comes to primary care, when it comes to the packages, to the gatekeeping of the primary care, etc. There has been clear, even combining, harmonizing funds, clear way forward. So we know the diagnostics, we know the reason why we have those challenges, and we know also solutions we're going to be talking about. The question, how we can really have a better engagement at the political level, and how we can make sure there is a breakthrough. Till now, unfortunately, which I'm sad to say that we haven't used this crisis as an opportunity to change yet. And I'm worried that windows almost closing, because the crisis will be a waste if we don't use them for the public good and for the benefit of the population. Crises are opportunity of change, and yet we're not really making use of that. So let me end by saying about what this policy brief that we have done together with the LCPS and FNF in terms of how we thought about the way forward.
Okay, perfect. So the challenges are very well known. The lack of inefficiencies, the lack of good collaboration, interconnectedness, fragmentation that we have. And I'm happy also to have heard the previous sessions before, because if you think about it, healthcare sector is not very different than all of the different sectors that we have in Lebanon. Now, let me talk a bit about the way forward and how this needs to be done moving forward. And there are a lot of low-hanging fruits that can be taken upon and opportunities that we can build upon moving forward in the healthcare sector. Next slide, please. One more, please. Next slide. Great. So at the governance level, it's very critical and very important that we have a common sharing of vision when it comes to the healthcare, to know where exactly to focus and where exactly the change needs to happen. And definitely that needs to be aligned with various system reforms, including, like Dr. Jardar was mentioning, the UHC law, for example, leveraging on that. And we are currently discussing with parliamentarians to see how a UHC law can be developed and implemented quite in Lebanon. Strengthening accountability and transparency mechanism on several levels, whether we're talking public sector, whether we're talking private sector. It's very critical that there is good concentration on the need for accountability and transparency in the healthcare sector. And also when it comes to mobilizing public pressure to implement laws that are anti-corruption, to ensure that the exact activities and opportunities that we are leveraging on are not taken for granted and do not lead for corruption. Next slide, please. Also, at the governance level, next slide, please. Also, at the governance level, it's very critical that we start shifting from what was the concentration previously of curative care to preventative and primary health care. Several countries that were in crisis, that had several inefficiencies, really concentrated on the preventative aspect of healthcare that made a huge change in their healthcare system as a whole, also enforced the implementation of universal health coverage through allowing primary healthcare centers to be the gatekeeping systems for healthcare services. Also, there's a need to harness on the power of the private sector. Now, the private sector is an ally to the public sector, and there is a need to harmonize this kind of relationship between those two, while ensuring definitely an oversight of the private sector to ensure better accountability and better services provision to the community, and also strengthening the regulatory framework when it comes to healthcare facilities, much of which is also for healthcare providers, and specifically when we talk about the pharma and provider relationship that happens amongst other relationships at the level of the healthcare facilities and the providers. Next slide. Now, we live in a country where emergency happen a lot, and there's a quite need for preparedness when it comes to emergencies. And the majority of the time, preparedness is the key for response for emergency. And this is something that we have learned throughout the years. When we're responding to emergencies in Lebanon, you realize that the response is haphazard, it's fragmented, it's not quite systematic and clear. So it's very critical moving forward that we start preparing for emergencies, and also to have a common platform when it comes to humanitarian response and NGO, because you've noticed over the past years, NGOs, humanitarian sectors have worked in silos in responding to emergencies. And now we hear more the need for better collaboration amongst those different organizations. Also, when it comes to interministerial collaboration and institutionalizing this work between ministries, because healthcare is in everything. It's in all sectors. When we're talking healthcare, we're also talking Ministry of Public Health, we're talking Ministry of Social Affairs, we're talking Ministry of Justice, Ministry of Economy. All of those more of ministries need to start coming together, discussing together the way forward, because fragmentation is the key for failure. So the best way to move forward is for better collaborations to take place, and also to ensure that we implement more evidence-informed policies and leveraging on actual research and best practices when decisions are being made. It's not just about a decision that is only political, let's say, but when politics and research and policy come together, there is better, efficient, and effective policy that is implemented. And this is something that we have learned throughout several years and in different countries and experiences. Next slide. Now, if we're going to talk about, aside from the governance level, there are several also ways moving forward when it comes at the financial level, amongst which the need to more of standardized tariffs along the different funds that we have. Now, you may know in Lebanon that we have several funds in Lebanon, and it's quite impossible to get everyone together in one fund, but there is a way moving forward to ensure that we have basic packages in Lebanon that can be implemented. And this is something that has been discussed over the years with several stakeholders on having one basic package for several citizens that are not able to access insurance, that are not able to pay for healthcare services. Also, the need for more of incentivizing the different sectors when it comes to financial level. And here we're talking more about the need to incentivize the different healthcare workforce also to stay in Lebanon, because with the current brain drain that we have in Lebanon, it becomes very critical and very stringent to move forward with provision of healthcare services. Is there anything wrong with this line? Okay. And until the slide is presented, I will move forward with talking about the need to concentrate more on value-based care, where we start concentrating more on the need for investing in areas where the healthcare services are actually going to give us effectiveness and efficiency on the level of the patients. Also, investing more on the need for health technology assessments, also where more assessments is actually being done at the level of technology before we start investing in that also. So dwelling more on the delivery level, it's very critical that we start moving into national policies that would reinforce quality in healthcare facilities in the healthcare sectors. We have a lot of low-hanging fruits in Lebanon. For example, the hospital accreditation standards have been developed, however, they're not implemented right now in Lebanon. Now, those are low-hanging fruit that can actually be implemented in Lebanon. Reinstating the standards for primary healthcare centers also is another aspect that can be more of digged upon at the level of delivery in the healthcare sector. Digitizing the healthcare sector, and here we're talking about more of moving into the digital healthcare system, and also more of ensuring harmonization of the different systems that are working in healthcare facilities. Also investing in the public sector infrastructure, because as you may know, currently with the lack of ability to pay for private services, we need to start reinvesting and also strengthening the public sector to provide services for the citizens, whether we're talking at public hospitals or also at the level of private primary healthcare centers, and also investing in medical tourism. Now, you may say that now might not be the best time for this, but it's the best time to start planning for this, because when the time comes for medical tourism to be implemented, we need to be ready. And this will be a huge influx of finances and money into the country. Next slide, please. And also when it comes to the pharma level, it's important that we start investing in national pharmaceutical card for the Lebanese citizens, and also investing in certifying local drug manufacturing in Lebanon. And for the level of the healthcare workforce, as I have previously mentioned on incentivizing the healthcare workforce, we need to do it in a very systematic and strategic way through a human resource strategy, because the brain drain, in fact, in Lebanon, whether we're talking at the level of physicians, nurses, or also other healthcare professionals, have also caused a lot of challenges to the level of the healthcare sector. And also establishing research labs and centers for specializations for the healthcare workforce, because one of the main reasons that a lot of the physicians and nurses are traveling elsewhere is because of the lack of availability of that. Next slide. Now, one of the most important aspects related to the health sector and the delivery of care also is empowering citizens. We can't forget this aspect, and we need to really concentrate on the need to empower citizens to be part of decision-making and policy-making at the national level and at also the organizational level, and also to raise awareness. Now that I have come to the end of this session that I'm providing, I just want to mention that the challenges are very well known and the solutions are very well known. What we need to take a step into is the will for change and the courage to start making this change, and the courage to start collaborating together to make this change, and hopefully to get over the crisis that we are currently in. Thank you.
Thank you, Clara. Very nice presentation also from Dr. Fadi. I think we will have some Q&A later on and some comments, but let me go with the panelists. Mr. Hanna Jaja is a registered nurse with over 20 years of combined professional experience in the healthcare sector, holding a bachelor's degree in nursing from the University of Antonine Babda, Masters of Business Administration from Chiefly Business Australia, led the oncology department at Saad Specialist Hospital as head nurse for more than 6 years, scientific affairs and educational manager at 3M Company for more than 10 years, recently nursing supervisor at LAU Medical Center, وعضو في مجلس نقابة الممرضات والممرضين في لبنان وأمين الصندوق. Thank you for being here. يعني, allow me to start from the end because we heard brain drain, and do we have a lot of shortage of nursing in Lebanon? That's one, and then definitely I would like to hear from you on your inputs on the reforms that you see are needed for the healthcare system.
ميرسي كثير لك. إذا بتسمح لي شغال. إذا بتسمح لي قسمها لقسمين. أول قسم قبل 2019 كهالسيكتور كنا بمطرح معين عم نقوم بعمل جيد جدا. لو وصلنا لأول أزمة بال 2019 الكرايسيس اللي صارت عنا أثرت كتير على الوضع الصحي عامة بلبنان. بطل في مصاري، العالم مش قادرة توصل لمصرياتها حتى تتحكم، الضمان الصحي بطل عم بيغطي، الانشورنس كمان بطلت قادرة تغطي المصاريف اللي عنا. لحقتها جائحة كورونا مع أزمة كتير كبيرة كانت جديدة علينا كلياتنا، تعرضنا لمشاكل كتيرة، عم نجرب نختبر هيدا الجرثومة الجديدة اللي تعرضنا لها. مع هيدا كله قدرنا تخطينا الموضوع، اجينا آخر شيء 4 آب. هلأ في كلام كتير حلو انقال إنه ما في تعاون بين وزارة الصحة وبين القطاع الخاص. هيدا هون نحن عم نفقده. بسبب هالأزمة كلياتنا بلشنا نخسر حكمة كتير من أشهر الحكمة اللي عنا إياهم، وبلشنا نخسر نرسات كتيرة، وهيدا الشيء أثر كتير على القطاع الصحي بلبنان. كرمال هيك اللي مطلوب اليوم تعاون، لازم نتعاون بين بعضنا كلياتنا، نقعد على طاولة وحدة، نتحاور، نشوف المشاكل اللي نحن عم نواجهها، ونشوف أفضل طريقة ممكن نحسنها. وتنبلش بنقطة كتير مهمة لنقدر نحسن، وهي معروفة بكل الشركات، بده يكون عندك مصاري. إذا ما عندك مصاري ما فيك تتحرك، ما فيك تعمل شيء. يعني هون هيدا الشيء مسؤولية الدولة اللبنانية، ما فينا نتهرب من هين النقطة، ما فينا نقول القطاع الصحي الخاص لوحده بيقدر يقوم بهيدي المهمة. وزارة الصحة إلها دور كتير كتير كبير وكتير مهم لتنظيم هيدا العمل، وهي تجيب الأموال من الدولة اللبنانية أوكي وتعطي هالأموال للمستشفيات كان الخاصة، القطاع الخاص أو القطاع العام، اثنيناتهم مع بعضهم. بقول حاجة كمان عن البوليسي والبروسيجرز والفورم، كمان we need to standardize our system، لأنه السيستم عندنا ما في هالستاندردايزيشن الموجودة اللي لازم نشتغل عليها، اللي كل مستشفى هي عندها السيستم تبعها، بس يكون في عندك سيستم موحد بكل لبنان، هيدا الشيء بيساعد. نقطة كمان انطرحت خلال الطوارئ، نحن شو عم نعمل؟ اللي عم بيصير خلال الطوارئ كل واحد عاد إمكانياته عم بيقوم ويشتغل بالعمل اللي قادر يعمله. بالوقت اللي نحن ما فينا ننكر هيدا الشيء، مع كل هالأزمات القطاع الصحي قدر يتخطى هيدول بأقل ضرر ممكن. قد ايه نحن قطاعنا كان قوي عن جد، ما نستهون القطاع الصحي بلبنان قد ايه قوي كومبير لكل دول العالم. يعني لو صارت هالأزمة رح أقول لكم إياها بأمريكا بحد ذاتها أو بالخليج، ما كانوا قادرين يتجاوبوا مثل ما تجاوب القطاع الصحي بلبنان، لأنه عن جد عنا أطباء كتير شاطرين، عنا ممرضين شاطرين، عنا جهاز طبي عن جد جيد جدا، بس نحن بحاجة نعمل فيه انفستمنت، لازم نطوره ونحسنه ونحاول ننقله لمرحلة جديدة. هيدا شيء كتير مهم بالنسبة لنا. هلا إذا بدنا نحددها شوي أكتر على الصعيد التمريض، إيه عم نخسر كتير ممرضين وممرضات، يعني عم نعلم كل هالشباب وكل هالصبايا، عم بيكون عندنا ممرضين عن جد جدا كفؤين، بس نحن تنصدرهم لبرا. نحن اليوم بهيدي الأزمة ما يقارب 3500 ممرضة وممرض هاجروا، الكان على الدول الخليج، يلي هولي عندك أمل إنه يرجعوا، عندك أمل إنه يرجعوا، بس اللي راحوا على دول أوروبا وأمريكا صدقني هولي صعب بقى تقدر ترجعون. فهيدي شغلة كتير مهمة إنه نشوف أي طريقة ممكنة نحافظ عليهم نخليهم بلبنان، لأنه نحن بحاجة لهم، لأنه عنا نقص كتير كبير إن كان بالمستشفيات ببيروت وإن كان بالضواحي. كمان وجهت نقطة كتير حلوة إنه مش بس المفروض نركز على بيروت، المفروض نركز بكل لبنان، بكل منطقة لازم يكون في عنا مستشفيات كتير مهمة ومستشفيات كتير كبيرة تستقبل أهالي المنطقة، لأنه هالمريض اللي موجود مثلا بمنطقة البقاع، بمنطقة الجنوب، بمنطقة الشمال، ما عنده أكسس على مستشفى قادرة تحكمه بطريقة جيدة جدا. يعني قبل ما يوصل لعنا عن بيروت صدقني في كتير عالم عم تموت على الطرقات، يمكن نحن ما بنعرفها، الإعلام ما عم بيضوي عليها، بس هيدا الشيء عم بيصير. إذا ما وصل ميت، وصل كتير تعبان، أنت مش قادر بقى تعمل له شيء. كمان لازم نوزع إذا بدك هالمساعدات المالية اللي لازم نطالب فيها، أوكي، على كل لبنان، تيكون في عنا مراكز مختصة تقدر تعتني بهالأشخاص الموجودين بالضواحي. هذا شيء كتير مهم. كرمال هيك هي عن جد مجموعة نقاط مع بعضها لازم نشتغل عليها كلياتنا سوا وبإيد وحدة وبتعاون واحد، نشيل السياسة على جنب. بالقطاع الصحي ما فينا نفوت السياسة، وهيدي أكبر غلطة عملوها صراحة بالدولة اللبنانية. بالقطاع الصحي ما فينا نفوت السياسة، بدنا نشتغل لصالح المريض، يعني لأنه هدفنا هو المريض وهدفنا هو الإنسان. ما فينا نغض النظر، ما فينا نغض الطرف. بغير شركات كانوا عم بيحكوا الصبح ممكن يصير في غلطة، هالغلطة بنقدر نصلحها. يعني غلطة شخص نزع ماشين فيك تصلحها، ايميل بعته غلط، اوكي بتعتذر، بتسحب الايميل، بتقدر تفض المشكلة. بس مريض يموت لقلة انتباه او لانه ما عندنا مراكز صحية، ما بعرف كيف بدك ترده هيدا المريض، ما بقى ترده، هيدي خسارة كتير كبيرة. يعني عم نتعاطى نحن مع حياة انسان، مش مع مكنة او بشركة او بمؤسسة او شيء ممكن تحله. كرمال هيك القطاع الصحي كتير 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 مهم بالنسبة لنا. بنتمنى من الكل، إن كان من وزارة الصحة، إن كان من نقابة الممرضين والممرضات ضمنيا نحن، إن كان من نقابة الأطباء، إن كان من نقيب المستشفيات، يقعدوا على طاولة وحدة، يشوفوا المشاكل اللي عنا، يناقشوها، ويشوفوا شو الحلول وكيف فينا نطور هالنظام الصحي. بالأخص إنه نحن اليوم قاعدين على فوهة بركان، ما بنعرف إمتى بتبج بلبنان. إذا بجت بلبنان، يا هل ترى نحن بعد قادرين نقوم بواجبنا تجاه الاشخاص اللي رح ينصابوا اذا صار في حرب بلبنان، رح نقدر امن لهم كل الاحتياجات اللي هن بحاجه لها؟ ما بعتقد، لانه بعتقد اليوم مخزون المستشفيات ما بيغطي يمكن شهرين 3 اشهر الماكسيموم. ادويه ما عنا، عن جد ادويه ما عنا، ما تفكروا انه عنا كل الادويه موجوده. يمكن بعض المستشفيات موجوده عندها ادويه، بس باكثريه المستشفيات ما عندها الماتيريالز اللي بنستعملها، ما في بكميات كبيره موجوده. فهذا الشيء بشكل خطر كثير كبير علينا نحن كلياتنا، على كل شخص منا. هون المفروض يكون في استراتيجي من الدولة واضحة بخصوص هذا الموضوع، بتقدر تحضر حالها. بعد معنا يمكن وقت صغير، ما بنعرف عن جد، ما حدا عارف. اليوم قاعدين كلياتنا بنقول يمكن تعلق اليوم، يمكن ما تعلق. بس إذا علقت لحد هلا نحن صراحة منا جاهزين. المفروض كان هالحكي ينحكى من شهر يمكن، ونحن لازم نقول في عنا ستوك على القليلة لمدة سنة، لأنه الحرب بس تبلش نعرف ايمتى بتبلش، بس ما بنعرف ايمتى بتنتهي. المفروض يكون عندنا ستوك على القليله للسنه، اللي كان من ادويه، اللي كان من ماتيريالز، اللي كان من اطباء كفؤين موجودين على الاراضي اللبنانيه، النورسات، كل المجتمع لازم يكون جاهز لاذا كارثه وقعت مثل ما صار باربع اب. كانت كارثه كثير كبيره، يمكن الناس حست فيها بس مش مثل ما حست فيها المستشفيات. يعني عندك كان 800 مصاب على مستشفى وحده، فرد دقيقه كانوا موجودين هونيك. كيف تعاملوا؟ عن جد يعطيهم العافيه، شابوبا. بس بكرايسيس اكبر ما بعرف كيف رح نتعامل. فبنتمنى من الكل يتعاون، نتمنى انه يحافظوا على هالقطاع يلي عن جد بعده اذا بدكم منيح وجيد، بس نحافظ عليه.
عندي سؤال لك، يعني عم نحكي تحديدا على النيرسينج اليوم. اذا كان يو كوانتيفاي، تيجي تقول اليوم نحن اليوم عندنا شورتج، بعرف في 3000 طلعوا، بس اليوم عندنا شورتج، بنقدر نقول عندنا شورتج ناقصنا 2000 او 5 او 10 immediately الجوب opportunity تبعيتهم موجوده حاليا بلبنان، ولا ما عندنا هيدي الستاتستكس؟ ما بعرف، يعني I don't want to get into now the discussions، بس اذا عندك كويك.
ستاتستيك صراحه ما عندنا قديش شورتج موجود بلبنان، ما بنعرف. بس اللي بقدر باكد لك اياه، بكل مستشفيات الضواحي في عندهم شورتج كثير كبير. هلا المستشفيات الكبيره يلي عم نحكي عنها، الاي يو، عم نحكي عن الاي يو بي، عم نحكي عن اوتيل جو، هيدول قادرين يجذبوا عدد كثير كبير من النيرسات، لانه عندهم فريش دولار، عم يدفعوا فريش دولار، قيمه كثير كبيره من المعاش، قادرين يجذبوا عدد الاكبر من الممرضين والممرضات، حتى من الاطباء. اوكي، بس بقيه المستشفيات لانه ما عندهم فريش دولار او قيمتها كثير قليله، بتحس ايه في عندها نقص كثير كبير. يعني تصور ببعض الطوابق بيكون في عندك تقريبا 20 مريض، عندك 2 نيرسز عم يشتغلوا بال 20 مريض، وهذا شيء منه جيد. على القليله المينيموم انه حتى تقدر تشتغل تعطي جود كواليتي للمريض، هي لازم تستلم 4 ل 5 مرضى ماكسيموم، مش مفروض تستلم اكثر من هيك الممرضه، ما مفروض ابدا اذا بدك عن جد تعطي حقه للمريض. بس المستشفيات مضطرين لانه ما عندهم حدا ومش قادرين يدفعوا، ما عندهم الامكانيات
هذا
الماديه.
ولا مش قادرين يدفعوا؟
الاثنين سوا، الاثنين سوا ما عندهم، مش قادرين يستقطبوا ومش قادرين يدفعوا. هلا يمكن اذا زادت المعاشات وتحسنت المعاشات على صعيد بس لبنان كلياته ممكن تمنع الهجره. بس بدي وجه او بدي اوضح نقطه صغيره. 3500 هون نحن بنعرف فيهم، بس في عدد اكثر فل، بس نحن ما فلوا من خلال النقابه، هاي عملوا الهجره وفلوا لبرا بدون ما يمرقوا بالنقابه. سو هوليك كمان ما بنعرف قد ايه اعدادهم. يعني اكيد مش رح اقول لك رقم خيالي، بس على القليل فوق ال 5000 ممرض وممرضه فلوا من لبنان باخر 4 سنين. قد ايه بدك وقت حتى ترجع تخرج 5000 ممرض وممرضه؟
Thank you, Hanna. Dr. Sola Aoun Bahous, thank you for being here. Dr. Aoun is a professor of medicine and dean of the LAU School of Medicine. She holds an MD degree from the Lebanese University, a PhD degree from Pierre and Marie Curie University in France, and a master in health professions education from the University of Illinois at Chicago. Dr. Aoun is a clinical and research, has clinical and research expertise that extend to fields of hypertension, hemodynamics, and arterial stiffness. Thank you for being here. Definitely, my first question before I ask you about the general suggestion on the reforms in Lebanon, being the dean of LAU, how is LAU supporting the newly grads, doctors, to adapt and contribute to the suggested reforms?
Thank you. This is a great question, in my opinion, because we're forming the future generation of physicians, nurses, and pharmacists, and their role in the society is key. So it's as important as teaching them knowledge and skills. They need to understand their role as agents of change, and this is part of their curriculum. And mostly when they are on the grounds, they see role models in front of them. So absolutely, this is very important. Yeah.
How do you see the reforms from your perspective? What is necessary for the healthcare system? What are the crucial steps, whether probably short-term or even long-term?
And I have a presentation إذا فينا نحطها. وبليز ما تحطوها presentation mode لأنه عم نتأخر. ما تحطوها presentation mode. Just advance without presentation mode, so we're faster. And I had the opportunity to read the document and to reflect on it, if I can say. So next slide, please. So I saw that Dr. Jerdali presented or looked at the problem and the policy brief, by the way, which I support. First, there was identification of how big is the problem. And it is big. First, because it affects a big fraction of the population, because it is discriminatory. The wealthy can get treated, the less wealthy cannot. And an important aspect is that it has been long-lasting. We know that the longer duration the problem is, the more difficult would be the solution. And I think what's even more dangerous is for us to adapt to a new normal which we do not want. So we have to find the solution, and this solution has to be fast. And by looking at the bottlenecks, there was, of course, we all know that there is a problem in governance, decision-making, the financial schemes, the delivery level. But most importantly as well are the mindsets, our behavior. And I will basically take the problem from this angle mostly. So we have to change the mindsets. Next slide, please. So also what was suggested is that to work on the law, to work on the accountability, transparency. That's why there was a suggestion to have a committee that is independent because it will inspire trust. It will be accountable to work on standardization of funds, also to have a tiered coverage, resource optimization, work on primary healthcare centers with an oversight, partner with the institutions, with also the NGOs, and at the level of the mindset, we should not forget education, education, education. And of course, think about health promotion and change the mindset of the population. Our mindset to accept to take a drug that's not a brand and to agree to a certain new scheme for healthcare delivery. So all these are suggestions. It's not to reduce what was proposed, but just to give it a certain framework. So the patient is at the center, and there are lots of things that we need to work on to serve this patient. I'll come back to this. Next, please. So this, what was presented, reminded me of a framework that shows that there are 5 control knobs that we need to account for. Behavior is key. Regulations, organizations, payment, and financing. So all these are really very important knobs that in every reform that we think of, we should consider and try to work around and address. Next slide, please. I personally looked at the problem a little bit differently because, as my colleagues mentioned, and everyone knows, we know the problem, we have idea about the solutions, but how to put them really into implementation. And I thought maybe let's look at our strength. When and how and where we did it right. So when we think where we were right, we know that at the private sector, we did better job by comparison to the public sector. Also, as individuals, we do much better or in small groups than when we are at larger groups. Also, when there is any emergency, we see that we're all working together directly, and we have some readiness level, like was mentioned, that may not be present at other places. And also, we're good at international connections. Next slide, please. So if we analyze why would we be good at the private sector, and there were lots of research related to whether the private sector is better than the public and in which resource country. The research showed that being at the private sector can give some autonomy, transparency, and accountability a little bit more than what exists at the public sector. And while reflecting why we do great as individuals and in small groups rather than in larger groups, I thought about recognition, because we all care about our ideas. We want our ideas to be recognized, and we want that at the larger scale, these ideas will be and really recognized that these are our ideas. And for the emergency preparedness, also I was thinking, what made us that ready? I think it's the sense of responsibility that any emergency situation creates. We're all very good. If we look at our culture, how we were raised, we really are responsible people when there is a danger that or a threat that we feel. And at the international connections, we usually, Lebanese, tend to be proud with the international connections that we have, and we benchmark and we learn from these international connections. So can we build on some important, I think, aspects that we Lebanese people have? Next, please. So if we go back to this model, and we see that there are connections, so if we do well at the private sector, I don't think there is a solution if we don't partner. So public-private partnership is really important, and this was suggested to have a committee with several partners to support the public domain, and this will give trust because this partnership will work within a transparency framework and accountability and responsibility framework. Of course, we need to set the goals and prioritize. Distribution of tasks, I think, is important. Distribution of tasks will give to every individual or small group the possibility of being a champion of something. So we do well when, as individuals, because of the recognition or because we want to be champions, we can still be champions, each group in their own domain. University A, for example, can work with the government on setting up needs for how many primary healthcare professionals we need to graduate. Hospital B can work on a financing scheme and be the champion for that scheme. I don't know. So all of these private entities can champion something, and we recognize them for this role. Then piloting, adapting, replicating, and scaling. So if we work around these to legislate, which was suggested as well, and work on capacity building, so at the right side of this graph, to be working toward the left side, legislating, educating, doing research, collecting data. So we know that partnering with universities helps a lot in getting some registries and research work done. So academia is really the hub of research. And we learn this way maybe from some success stories. We know that low-resource countries are champions of some innovations. If we go to the next slide, which is the final slide that I would end my presentation with, some key considerations. Maintain constancy in articulating our needs. We tend to get tired easily. So thanks to this forum, I think we need to nag and continue nagging and never stop talking about it. Second, I think we need to believe in baby steps. We all think strategies, which I personally do as well, and every time there is any suggestion, I try to put it, where does it fit in a strategy, which is a proper scientific way of approaching things. But baby steps do a job, believe me. We know that there is the tipping point, but this tipping point, in order to tip, the glass should be full, and it will be filled with baby steps. So we should not neglect the importance of baby steps. Stimulate reverse innovation. We have a great innovation, telemedicine. We know that the low-resource countries contributed a lot to innovation, and by reverse innovation, which is the innovation with and for the low-resource countries, we're really learning experiences for high-resource countries. So, for example, if the government or universities or this public-private partnership will launch a competition at the national level for the best application for, let's say, reaching out to the remote areas and give service to people with hypertension, let's say. So we will be engaging the students. We will be looking at talents, helping in the solution, and stimulating innovation. Engaging stakeholders, as I said, academia, healthcare professionals, hospitals, the patient are all stakeholders, and value the partnerships that we have. So I just tried to present things from a different angle, from our strength, to maybe contribute to the solution.
Excellent. Thank you so much. I think, thank you for the presentation. The approach is nice and different. I agree with the mindset change and cultural change that, yes, we have at one side, I think we all have to reduce a little bit of the Lebanese ego somehow to be able to collaborate, contribute, to be recognized for a fraction, not for the whole. So probably somebody or a company or a hospital is great at this, but they don't have to be great at everything. And regarding the public-private partnership, I think, and this is honestly a major dilemma, where you see every Ministry of Health or every project is always trying to strengthen and support the public hospitals. Nevertheless, this is a major question. Do we really, I don't know, you said we should. Do we really need in Lebanon to support now building and increasing the capacity of public hospitals? Or we need more public-private partnerships? So, I don't know, if a hospital X is near, sometimes بيكونوا 100 متر بعاد عن بعضهم, the public and the private hospital. ويمكن يعني this hospital can do this surgery. They can partner with the private hospital to do different type of procedure. The dialysis تكون بالhospital. We don't, the MRI ما ضروري تكون in the hospital. We can outsource it from the hospital that is next to it. So probably the public-private partnership can be a critical point, a tipping point for the Lebanese healthcare system. لأنه what we do good is private. We know it. So thank you for that. I think we are open for Q&A. Sir, sorry, yeah, first.
Thank you. Thank you so much, Karim Al-Farikh from ANERA. Thank you for the presentation, and thank you, Dr. Salah. You were spot on with many of the comments that I wanted to say. One of this, I want to really emphasize the importance of the, not only the government is at fault in reforming the healthcare, but it's us, the public, as well. We don't have this mindset, and not just the mindset of taking a generic brand, a generic medication rather than a brand, or to lower our ego, but to change our mindset of going to a primary healthcare center because we just want checkup. No need to be, for us to be ill to go to a primary healthcare setup. So change primary healthcare centers. So change this mindset from a curative mindset to a preventive mindset. I want to go for a regular routine checkup where in this checkup I might discover, I might be screened or diagnosed for many illnesses. So there's, right now I've noticed, I've worked in the primary healthcare at the Ministry of Public Health for 3 years. I've really noticed the lack of trust of the public in their government. And this, in the past 2 years, the primary healthcare center primary healthcare network has been growing really big. So it is, I think, time for us to give it a chance so we can gain the trust again and believe that it is, I think, one of the main solutions that will really help reform our healthcare. Another thing is, right now the healthcare is dependent on the humanitarian aid that is being sent from all the NGOs and all the UN agencies. I think one of the strategies for reforming this is to channel this aid into a developmental aid, not just a humanitarian aid. We need to change also the mindset of the donors, not only give us for a short period of time as a humanitarian response, but also to channel these funds to be able to put them in a developmental program, like investing in the healthcare force, investing in the programs that are currently at the primary healthcare center or at the public hospitals. So I really want to emphasize the points that all of you said. The mindset is really very important in order to move forward and do our job in parallel to what the government should do. Thank you so much.
Go ahead.
Thank you very much for providing us with the view of the healthcare sector in Lebanon. My name is Suha Hallab. I work with Beirut. I am currently in the process of forming a knowledge and innovation community where I am involving governmental representatives, right, with the public sector, with the private sector, along with universities and business support organizations. So what I would like to ask Madame Sola, Dr. Sola, yes, can you give me an example of reverse innovation and how it can be applied in Lebanon? Thank you.
In Africa, in South Africa, for example, in sub-Saharan Africa, there were problems with blood pressure control. And they did a competition at the national level, and they worked on a solution, technical solution, device. They evaluated what the patients use in their daily life, their cell phones, and so on. So they developed an application, and they got some financial support from the government to devise some blood pressure devices that are accessible, would be accessible. And they demonstrated through a plan that involved pharmacists and nurses that blood pressure control improved. And now from there, this model is replicated everywhere. We know now that blood pressure is better when we have nurses and or pharmacists with the physicians reaching out to the people and patients in remote areas. So this is a reverse innovation model that was published, and it's now used by high-income countries, and it's leveraged through this way.
Are there any ideas for Lebanon that you think can be under the umbrella of intellectual property or patenting?
There are lots of ideas, of course, but I still think that having really competitions at the national level, what we call it's layered, because there will be lots of projects that will reach some point, and when they reach some point, there should not be just one project that will win. So there will be incentives given to some other projects to be redirected to other channels. So there are lots of ideas, and yes, definitely, Lebanon is the place where we should think of reverse innovation.
Thank you very much.
Yeah, thank you for the presentations. Talking about the change in the mindset, that also complements what was said in other presentations, that, okay, if I want to take any brand medicine, I would prefer to take a brand medicine if I find it, because I don't trust the non-brand medicines because of the no certification, no control of what is in the pharmacies. So this is really very important for a mindset to change, or for me also to go to a primary clinic or a public hospital, also to trust the quality of consultation that I will have from the professionals in these entities.
That's right.
So it's a change of mindset, but that should go along with other regulations and enforcement of control and monitoring and laws.
One example could be of public-private partnerships. If we trust that, let's say, a physician coming from the 8 medical schools in Lebanon is trusted, for example, we can have these physicians go to these primary healthcare centers together with the existing physicians and work together until you build trust. Trust is not built just in a day or two. It needs some time. So there are lots of models of partnership in that regard to build trust. As a university, for example, if there is a plan to increase the primary healthcare professionals to be graduated, it's my job to respond to a national call. So this is an example of how academia also can support and should support. This is our social accountability.
trust حتى for example procedures. يعني we all want from the government to regulate, so rather than to operate. I think if we push the government for more regulations and let private sector to operate, we will move faster, and we will gain much better trust in adopting whether technologies. يعني if tomorrow the government will announce that we're doing a local manufacturing facility for drug X operated by the Lebanese government, probably no one will take it. I'm sorry to say it. Okay, but if they regulate and facilitate for a local manufacturing facility to do that, they will. So we should know who does what. يعني that. Please. Yeah.
Maybe
Please go ahead, and then I'll add
okay,
my
thank you. Okay, very quickly, I think we really need to build on the very valuable comments. I think that Dr. Sola mentioned quite well, in principle, the success of the private sector. Let's put it this way. But we have all been looking at the distress and the complete failure of the public sector on all fronts, whether that's policy making or directions or direct care or hospital management, doctors, nurses, everybody. So nothing has been working there. So if we're gonna try to get some different result using the same methods, I don't think we're gonna reach anywhere. So we have to think a bit now and really start pushing a bit further. It's nice to ask, is this the model that we should not challenge? I think we should challenge, and we should say that this is not working. And is it enough to say that we're gonna go through something called a public-private partnerships? I think it's also a bit misleading because the infrastructure for something like this does not exist. Every time you bring in public, small, big, co-worker, etc., you will get entangled with the same system. So there is no way out of this. So how to segregate those two things? I think the best, and I think because I was privy to the whole discussions about the new law that was enacted on pharmaceuticals, which created now an FDA, which is still not in place, but eventually it will be in place. So there is a regulator in everything. There is a regulator, and there is basically who should be independent, working, and there is the service providers. All that the state should do is set policies in general that have to be taking care of people's health, general issues like emergency reactions, etc. But what is important is that we also segregate the power of using a Ministry of Health for political reasons and for wrong financing and for getting this person versus another person, taking into consideration that no health pass, no ID card will pass before there is a serious reform on this level. And most importantly, we probably need to also segregate the money. So no more money from the government. And they should not touch them because government doesn't have money other than by collecting taxes or using the funds that already exist, such as the NSSF, etc. All of this money should go to, again, trustworthy systems that pay trustworthy hospitals within a regulated environment. This is a strain of thinking that may get us out of the situation where we are. I am sorry, but, and I will repeat maybe a comment that I said before. We were not doing well when they started 331 in the technology sector. Because on the 1 billion or 1.2 billion that were spent, maybe 50 million got to the right place. And we were not good before 2019 in the health sector. It was just unimaginable that Lebanon spent $450 million per year on cancer-related drugs when Saudi Arabia spends 500 million. There were numbers that are unbelievable, that drained us and got us where we are today. So the future thinking, I think, is a combination of a lot of private work, setting the standards, segregating the responsibilities, and having each champion their own field.
Thank you so much. I think we're running out of time. You wanted to quickly say something? Yeah.
And very important point now, definitely when it comes to the health sector, there we need cohesive and systemic changes and reform in Lebanon, because the bits and pieces currently are not working, and we need to start working from different areas. And thank you for mentioning the issue related to more of also the trust and the systems that we have, but leveraging also on what we actually is working in Lebanon, such as what was mentioned related to primary healthcare centers, and ensuring increasing trust in those centers, in fact. Now, what I wanted to finally say is, when you were mentioning the public-private partnership, several countries globally have worked on not increasing capacity of public sector, but ensuring efficiently of utilization of the public sector and leveraging on the private sector while ensuring oversight of that. And having both working at hand in the country, and especially in Lebanon, knowingly that we have a very strong private sector, we need to ensure that we work with it for the better health provision in Lebanon. Thank you.
Thank you so much. Thank you, everyone. Thank you, panelists. Thank you.
Thank you very much for this very interesting panel and for very timely information that you shared with us.